With that said, welcome Dr. Chee, Dr. Charles, to Hmong Wealth Builders show. We try to do this once a month, to just engage our community and talk about the different things that we're doing in terms of building wealth or anything that's in our community. Of course, there's a lot of different platforms, that focus on other things, but we're here to try to bridge our Hmong community together. So, welcome to the show, both of you guys. Why don't you do a quick introduction of who you are, and just sort of 30-second, and just say hi to everybody. Charles, you want to go first? Oh, we can't hear you anymore, so let's see.
You guys hear me okay now?
Okay, yeah, that's
Okay.
good.
Hi, everyone. Thanks for joining us. I'm Dr. Charles Vang. I'm a family medicine physician. I train here in the Twin Cities at the University of Minnesota Medical School, and then I worked as a family medicine physician for about the last 10 years or so here in the Twin Cities area. So, in addition to medicine, I do a lot of community work. My father was fairly traditional, and he was a cultural and clan leader, and so I followed him a lot. And so I'm still fairly active in the Hmong community in that sense as well. So thank you for having us on too.
Yeah, I think both of you guys are the least like the most non-doctor I know, along with Dr. Lucky. If you guys know what I mean by that.
we know what we're doing when it comes to medicine, but we're pretty chill, I think. You
Yeah,
probably couldn't pick us out of the crowd.
yeah, yeah. How about you, Chi?
That is a compliment. Okay, we'll
Yeah,
take that as a compliment.
yeah. So
I'm
Dr.
Dr.
Chi,
Chee
yes.
Vang.
Quick introduction.
Yeah. First off, Fang, we appreciate you and Hmong Wealth Builders for having us come on for this platform to talk about a little bit about ourselves and our journey. Um, I'm a family practice physician, born and raised in Minnesota. Did all my schooling here, did residency here, and Charles and I actually went to the same residency program and worked
Mhm.
together for a while before we decided that it was time to open our own practice.
Oh, good. So uh, both of you guys are Vang. So the reason I don't say Dr. Vang because I wouldn't know who to talk to. So I kept calling you by your first name. So I hope you guys don't mind that. But what's your relation? Are you guys? Yeah, talk about what your relations are, and I guess you guys went to the same school. So maybe talk about those early days too.
Yeah, we've been confusing people since medical school, so that's quite all right. Yeah, we did medical school together. Dr. Chi was a couple years ahead of me, and then that's we actually met in medical school, and then we did residency together as well. So that's where you get 3 additional years of training to become a specific specialty. So for both of us, it was family medicine, and they had to call us by Dr. Chi and Dr. Charles as well at that time, just because we're both Dr. Vangs and Dr. C Vangs as well while you're at
Yeah.
it. So, and we actually ended up working together afterwards too, for 5 additional years before we kind of went on our own for a couple of years, and then we ended up coming back together and creating this urgent care.
Cool. So
Yeah,
you
but
guys brothers, cousins, or what's
no,
the relation?
so yeah, I mean we're both Vangs, right? And
Yeah.
so if you're Vangs, you're both Vang, you're related somehow. But if you go up the tree line, it's several generations that we've been removed from each other. But our families have lived here in the Twin Cities area, and we do a lot of things together.
Yeah. Yeah. Yeah, that's awesome. I've met you guys. The reason I said you guys are the most non-doctor doctors because when I moved here about 8 years ago, we did see each other a lot.
Hmm.
And there's never a sense of I mean, maybe I don't know how to word it correctly, but there's no arrogance between. All you guys are very humble. We do have other Hmong doctors that they hold their title a little bit too tight. But you guys are always humble and always. I appreciate you guys always helping the community. Um, yeah, so talk a little bit, maybe. Well, let's talk about right now. Then we can kind of go back. Like, what are you guys doing right now? Like the urgent care that you guys are. So maybe talk a little bit about that and why you guys decide to open up a urgent care center.
Sure. So our urgent care is called FocusPoint Urgent Care, and we decided that after years of working for large organizations in Minnesota, we decided it was time to open a clinic that serves all communities. But because we are Hmong speaking physicians, we tend to attract people that come from let's say, socioeconomically disadvantaged immigrant and refugee communities. And so Charles and I made sure that when we practice, we were open and receptive to treating everyone. Um, Being Hmong speaking physicians has been a blessing. We've been really blessed to serve our communities and watch it grow and change over the time. In addition to this, one of the things that made us decide that it was time was just seeing the need. Whenever you guys go to urgent care, ER, or clinics, you're scheduled a long time out. I mean, you can see the wait times on the websites for the urgent cares, and they're like hours and hours. And sometimes in ER even longer. And then when you're trying to get in to see your primary care doctor, it would be like 2 or 3 months, and that was not something that was we thought was feasible for accessibility for our patients.
Yeah, definitely. I had to drive when my wife needed care. I drove to Wisconsin
Oh my
because the wait wasn't long there. I mean, it's like
Wow.
a 20-30 minute drive, right? And right at the border right there.
God.
Because the ones over here were just like way too long. So I feel exactly what you talked about. So thanks for doing that. Um, let's let's take a let me see. Right here, Yi said they are quiet secret millionaires. We could share that later. Sai has a comment, but we could pull that back up later. Let's. I'm glad you guys are putting the urgent care together. Or now that you guys are opening, and you guys have your grand opening coming up here. Can you talk a little bit about just that? Let's kind of go back, right? A little bit. Were you guys born here, or you guys born in Thailand and Laos? Or-
Yeah, so we were both born here. I was actually born in California,
Okay,
and she was born here in Minnesota.
cool. And
Yeah.
and so you know already within our Hmong community, our Asian community, but the law always okay. You guys get good grades. Go become a doctor, or lawyer, right? That's always the
Yeah.
mantra.
Yeah.
Yeah.
Um, I went to school, but I was a failed engineer, so I ended up doing math. So doctor, lawyer, engineer, I failed at that. Uh, but you two succeeded. Like, talk about a little bit your upbringing, your journey. What are your thoughts about, because you guys achieved, sort of the Hmong American dream, right? Having the kids like pursue one of these professions, and you guys made it, right? So maybe can you talk about a little bit about your guys' story? Well, when you grow up, your experience with what your parents kind of want you guys to do. Did they pressure you guys, or this is something that you guys found on your own?
Yeah, I was definitely pressured. So my parents also told me that I had to be a doctor, a lawyer, an engineer, or a teacher or police officer. So I actually had 5 choices to
Wow.
choose from. And my dad actually sat me down when I was in my early teens, and had to quote that, "Cú sai có rừng gọi có kinh đó nè, chỉ ya tao nè chỉ cú sang có a doctor." And so he actually told me specifically that that's what he wanted. And Kuno Jake, we had to Tupluna, so with the oldest son, there's certain expectations and such, and I was the one who was kind of paving the way for the family, kind of figuring things out and doing things for the first time. So there's pressure in that as well, in that I wanted to make sure that I did as much as I could to kind of pave the route for those who are coming behind me, so that they could see that they could do it too. And so I listened to my father. I followed the route. Fortunately, I was pretty decent at school, and then I found I actually really like being a doctor. I like the science part of things. I like helping people. I like being involved, especially when people are at a point where they're really struggling or having difficulties. Finding them a path so that they can become healthier and better, so that they can continue to do the things that they enjoy doing.
Yeah.
So yeah, pressure, but good pressure, I would say.
How many siblings did you have? Because you're the oldest. So.
Yeah, so I have and there's 6 of us total. But I have a lot of younger cousins too, and so even like within our clan system, I was one of the oldest children, and so
Mhm.
it was a lot of people who were watching me.
Yeah, Chee, how about you, Dr. Chee? Uh,
I was born in St. Paul. My schooling in the St. Paul public school system. Graduated from high school, and then went to the University of Minnesota Duluth campus. Uh, I went there because I got a full ride there, and I actually majored in computer science. Believe it or not, I wanted to be the world's greatest video game programmer, and it did not work out that way. I was
so
taking
you're a failed programmer.
Yeah, I love programming, but it turned out that I'm a people person.
Uh-huh,
My girlfriend, who is now my wife,
uh-huh,
we were taking classes together, and sometimes I'd sit in on her classes, and then I'm like, hey, you're taking these really cool science classes, and I'm like, I'm really enjoying it, but it's not part of what I'm doing. And I was like, okay, why don't I if I'm just gonna stay here, maybe we'll learn as well. So I did a minor in chemistry, and then ended up being I'm really good at biology and chemistry, and I was tutoring and teaching it as well. And
uh-huh.
then I was like, oh, if I do that, then maybe I should consider something else beyond computer science. Now,
Yeah,
similar to Dr. Charles, of course, my parents wanted me to be a physician, and I did a lot of uh, things that like volunteering at hospitals,
yeah,
and actually shadowed Dr. David Tao and Dr. Shulta actually
uh,
very very long time ago
yeah,
for 2 days, and I was like, oh, you know what? I don't know if that was for me, but after going to college, I said, okay, you know what? This is something that I could see myself doing. And then I ended up changing. I finished with my computer science degree, and then tried to get all the pre med courses done, and I still didn't finish. So I took a
uh,
non-traditional route where I took a year off, and then during that year, I actually went to Century College to finish whatever classes I need, and then after that, I did the MCAT and then got into medical school. So.
uh. Well, I thought you're kind of opposite of what I did. My college girlfriend was a biochem major, which every single doctor's every pre-med's like all biochem. But I sucked at chemistry. I'm sorry. Like, I did it chemistry for my GE. I almost didn't pass, but my girl helped me through it. But then I did all my engineering stuff because I was CS major. Um, but like, but then like if wasn't it like you go to like all the pre med courses, like you have all the girls there? Was it
Yeah,
like that for you guys too? Because that was what it was at UC San Diego.
I would say, yeah, you could say there are definitely a higher proportion of women in those
Yeah,
classes for sure. Yeah.
yeah. And then you go to the engineering, like we did the. I love physics, so I excelled in physics. But chem was kind of harder for me. Well, in all the physics classes and all the engineering classes are mostly guys now are there. So I used to go just to try to talk to the girls back then, but that was back then. Yeah. So you guys went through the route, have you been gone through it? Were there any challenges and stuff like that? Any advice that you could give to any among or any young individuals that are going to college that is pursuing medical school like you guys?
Yeah, so Chi and I actually we do quite a bit of mentoring on the side, and one thing I strongly believe, and what I tell students who come and work with me is that once you get to where you want to be, turn around and pull people with you. Just because we remember how hard it is to go through all of that, and med school is very hard. The way that it was described to me before I went was if you take a fire hydrant, if you turn it all the way on, and the water's like flushing out at full blast, you're trying to drink the water as fast as you can. That's a med school. That's the amount of information that you're getting all at once, and so you just drink as much as you can, and then you hope for the best. And then, but it's definitely one of the most challenging things I'd ever had to do. And actually, after my second year, I actually almost quit because of how intense it was. And I was spending like 16, 18 hours a day just studying. every day for like months and months on end, and that was not sustainable. And that's actually one of the times where it was really helped me mature just as a person to kind of take a step back and knowing that going to school, studying is really important for me. But then I had to make sure that I took care of the things that I prioritized otherwise too. So taking care of your own mental health, making sure that you do the things that have always made you feel happy. So going out to family events, seeing friends and such, kind of reminding yourself of why it is that you're doing what you're doing. And so that was where I developed what I would call intrinsic motivation as well, where I'm doing it just because this is the right thing to do. Nobody else needs to tell me that I need to do it. If it's the right thing, I'm going to spend this extra time to do it because it's going to be helpful not just for me, but everyone else that comes along as well. And so when people are going through really difficult type of schooling, like medical school or anything in life, really, make sure that you take that time to step back, reevaluate as needed, and make sure that you have everything you need to make a good, sound decision for the long term.
Yeah. Yeah, that's really great advice. I had to learn this from some of my mentors. Obviously, I'm in the real estate entrepreneur space now, but um, like my wife and I, we kind of take sort of annual trips together, just the two of us to recalibrate, why we're doing the things that we do, and
Yeah.
yeah, and yeah, so I think that really helps. How about you, Dr. Chi? Like any words of encouragement or recommendation you could give to the next group of individuals that would be, studying to be in the industry you guys are in?
Absolutely. Um, as Dr. Charles had mentioned, we still continue to do mentoring for a lot of pre-med students. And we know it's a long route, so part of the journey is having endurance and understanding sacrifice. And your friends are gonna be hanging out. Like and then you're gonna be studying. And I used to joke with people like, there used to be like a bar called the Library in Minneapolis, and your friends would go there, but I'm actually going to the library, like sitting to read and do stuff. I do feel bad, but in the end, it's worth it. One thing I remind myself is if you have a dream and the dream doesn't scare you, then that dream isn't big enough, right? So
Yeah,
you need to learn to have those skills to move towards that dream. And part of it is also finding the right mentors. And Tufan, you bring up the mentorship idea, and I will tell you, we as human beings, we're not we don't know everything when you're born, right? You
yeah,
tend to specialize in one thing, and so you have to make friends with people that know other things, and you also make friends who've already gone ahead. Like,
yeah,
they came back and and there's I've been very blessed to run into those people, and because of that, one of the greatest things they said to me was, "Chi, after you get to where you're going, you need to do that too, because you need to bring the community with you as well, because this is a community thing to create health and wellness for the whole community."
yeah. Yeah, and even in like the entrepreneur space here, I feel the same way too. Like when I meet true success, individuals that are truly successful, they always want to give back. Like all my mentors, I never actually asked them to be mentors. I just like asked them questions, and they like were always willing to give back. The ones that I have some colleagues that they don't, but the ones that don't is because they're still going through their own thing. That's what I feel like, and so they just don't have the opportunity to do that. Yeah, but everybody that are successful, they're always willing to give back, like all the time. Even me, like when I first got here, I met with Dr. Neil at Metro because what I really wanted to do was to be a professor. Actually, that was my thing. Like I knew I was good in math. I knew I was good in physics. I was gonna go do math and physics, and do some econ stuff. And my goal was always like, okay, then I go work on the field, come back, get my PhD, and go teach at a community college. Like that was what I wanted to do. Um, and but then uh, it took me a while because I also wanted to make money, and I was like, how do I contrast that? Uh, But I think just like for me, I think teaching just come to me. I just like to share information with people. I think that's a form of teaching. Like Dr. Neil kind of helped me guide me through that process, and I didn't necessarily have to be a professor like him, right? You guys don't know Dr. Neil Tao is a
Hmm.
professor at Metro State over there.
Yeah, yeah.
And so yeah, he kind of helped me guide through that process where it's like, okay, I don't necessarily have to do it formally, but if there are things that I know, I could share that, and that helped me create this platform, right? Like
Mm.
for us to come and share, and you you just teach the next individuals that wants to learn. So yeah, I get all of that. That's really great. Um, thank you for giving the advice for the upcoming Dr. Chi and Dr. Charles that you guys are listening in here. Uh, so then let's get back to where you guys are at today. Like you talk a little bit about your urgent care. Where's the location of this urgent care, so people know?
So our urgent care is located in Maplewood. The exact address is 1774 Cope Avenue, East, Suite 110, Maplewood, Minnesota 55109. So for those of you who aren't familiar with the area, it's right on White Bear Avenue and Highway 36. So Maplewood's kind of a odd city in terms of its shape. And so it actually crosses over multiple cities. And so it's right next to St. Paul, but also North St. Paul, Oakdale, and White Bear Lake. And so we're kind of in this intersection of multiple groups of people, and we wanted to make sure that the clinic was accessible both by private car, but also by public transportation.
Yeah. So I found out about you guys because we have a mutual friend Yi, and he was helping you guys develop the place there, and so our team ended up coming over to do some of the plumbing work that was there.
Mhm.
Hopefully the team was okay um, to do the plumbing. So if you still have plumbing issue, let us know. We'll come out. Um, and so that's the place that is right across from McDonald's, right? McDonald's
Yeah.
right there on 36, and I think U-Haul is on the other side of White Bear right there. So if you guys want, it's right there. It's very localized here in our St. Paul area in Michlet. Um, you guys, when I looked through your website, I did a little research about your urgent care. Uh, you guys kind of like, can you talk a little bit about your like pricing transparency? This is something that I could never get my head around healthcare, because they're like, when you go to the doctor, we go to these larger organization, then we don't know what was treated, we don't know what was charged at that time. We're distressed, by the time we go there, right? But your urgent care there, you guys, I saw all the pricing, everything, all the different things that you got, all the services that you offer, you already all the pricing that's there. Like, can you guys talk about a little bit about why you guys show all that pricing, and then maybe what are you guys trying to achieve with all of that?
Sure. So our business, we provide both primary care services like chronic disease management of diabetes, high blood pressure, cholesterol, gout, and then also urgent care services like minor illnesses, minor injuries, like upper respiratory infections, things like that. And we found that it's really helpful to kind of explain what we do for patients, and then they understand the value of what we do. We accept all major insurances in Minnesota, like Blue Cross Blue Shield, Aetna, Alina, Health Partners. We also accept like Medica, Medicare, Medicaid, Health Partners. Although everybody should understand that each insurance is a little different. So sometimes, even though we accept it, we may not exactly be in network sometimes, depending on which insurance you have. And then we offer self-pay options for patients that don't have insurance, because many times insurance is really expensive. And so when it's that expensive, like, what do you do? So we wanted to create an opportunity for patients to have accessibility based on pricing too. If we looked and we researched and we found that the price of the visits and the procedures that we're doing are pretty affordable compared to all the other ones in the area. And we like to have that transparency because it's really important for patients to understand the value of where their money is going.
Yeah. Yeah, I think also just being able to see pricing before you come to do a visit, right? Because like I
Mhm.
said, I mean, it's urgent care. You guys provide primary care as well, but if I come there for urgent care, I'm kind of distressed already. I like at that point, like I don't care. Like just make me feel better, right? Um, but I think just being transparent with all your pricing ahead of time, for self pay, you know, for me, I think we need more of that, and I hope that future urgent care, even the big companies and organization, they should publish all of this, you know, all their pricing. And maybe
Mhm.
they do, I don't know, but it's obviously difficult to track down, right?
You have the right to ask for it when you go to your
Yeah,
office. You absolutely have the right to ask for it. Even before you go into the visit, you say, "Hey, can I get a sheet of what was available?" And they should be able to give you something. It's not always exact, but it's a pretty
yeah,
close estimate. You know.
Mhm.
yeah. But you know, and I know that's not how the practice works, right? Once you go, like you're not asking for that. I think just making transparent by default should be the right way to do it. I'm glad you guys are doing that.
Yeah.
Yeah, and one thing we try to do is we try to be honest with folks, right? The healthcare system is really complex as it is, and we
Yeah,
try to simplify it as best as possible, but also make it affordable.
yeah,
I joke with Chi that we're too honest; we're not going to get rich at all. but I think what we really care about is just the quality of care. We
Yeah.
believe that if we provide good quality, people will continue to come. And that's worked really well for both of us in our individual practices prior to coming here. And we suspect that continuing offering quality care will continue to help us be successful as well going forward.
yeah. And to share with everybody, you guys are not brand new, right? You guys have been in the industry for quite a bit before you guys decide to open up your own facility here.
Yeah.
Um, yeah, and you wrote a book, Dr. Chi. I ordered the book, but I didn't get it, so I'll get it tomorrow.
No worries. Yeah.
Yeah, yeah. Um, yeah, so right here, I mean, today we're going to talk about how you guys were able to build this facility, not just from the soft cost side and from your expertise, but also to the actual constructions and stuff like that. Um, Going through this process to build this facility out, what have you guys learned? Who did you have to lean on to kind of help guide you guys to make sure all the constructions are there? Because you guys aren't like developers or construction guys, right?
Mhm.
So can you talk a little bit about like getting the idea of you guys want to open your facility, and then what do you have to go through to get to where you guys are here now, having the facility ready to be open?
Sure. It's a terrifying and exhilarating experience all at one time. It's like you experience both at the same time all the time. But I will say the transition from like being an employee to be, your own business owner it's a great journey. And we're very blessed and privileged to have the opportunity to do so. Actually, the book ties into that. So I wrote this book
Yeah.
called
Oh, yeah. Yeah. Let's see it. Yeah.
Charlie Goes to See the Doctor.
Yeah.
And this is a book that's in English and Hmong, and it's about a child that goes to see their doctor for the well child exam. And then it has both English and Hmong, and then it has anatomy that's both in English and Hmong, which is really nice. One of the reasons I wrote that was because I wanted something to leave behind for like my children and just the Hmong community, something that'd be fun for them to read and something related to medicine. But at the same time, I created my first LLC using it to be a self-published book, and that was a great taste of a little bit of entrepreneurship, in terms of like figuring out how to do all that. And then, you know, afterwards, after working for corporate medicine, you really see the need. And then in 2025 is, the year that we officially really went into figuring things out when we left corporate medicine. And I will tell you, the jump was it was tough. It was definitely tough, but it was the right time. And I've been very lucky that I found a business partner that really understands that we have to sacrifice a lot to where we're going, and also
Mhm.
was ready at the time in his life that this was the right time as well. Um, I'll tell you something. This is one of the most humbling experiences I've ever done. I think being a small business owner is even tougher than being a physician, and I want to give the accolades and all the best to all of these small business owners, like who just own restaurants and stores and everything else. Like they work hard. They're on call all the time. I thought it was hard when I was on call, maybe one night a week or one week in a month or something. No way. When you're a small business owner, you never sleep. Like it's all you're doing all the time.
That is so true. I know you're not dumb, but when I started my journey, I was like, everybody should be an entrepreneur, and then now I'm trying to get everybody not to do it. So I'm like, I'm reversed now. I'm like, don't do it, don't do it. And then if they really want to do it, then let's talk all that, right? Um, but yeah, talk more about that experience. Like, how's that different from
Sure,
now that you guys are working for yourself and
absolutely.
yeah, and then even the continuing because I stopped you there, but continuing through that process to getting the right team to for you guys to actually do the build outs, um, and getting the right employees now because now you guys have employees that you guys have to look after now, right?
Absolutely. It's definitely different. When we were physicians for like large organizations, we were the employees. We didn't realize how much they were doing behind the scenes and how big of a team of support that you had, and
Mhm.
you do miss that. But at the same time, like you can be more efficient with the things that you have too. Uh, when Dr. Charles and I decided that it was time to open our own business, we were physicians. That means that we knew medicine inside and out. And medicine by itself is its own culture. It has its own language. It has its own traditions. And like that's why when you come talk to a doctor, we like try to figure out how this works. Even the system is all over the place. It's very hard for people to navigate. And
Mhm.
then now moving from that world into construction was absolutely crazy for us. We're like, oh, like what do these terms mean? What is this? What is that? Like, how do you find a building? How do you schedule this? Who's a good plumber? Who's a good electrician? We knew nothing of that stuff, and we're lucky enough to find someone that could help us figure that out. And actually, I'll let Dr. Charles talk about that because he really remembers how hard it was for us when we did this.
Yeah,
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 yeah.
sure.
When we started the process in May of 2025, we we thought we'd get everything done and ready to go in 3 months. So when we talked to like the building owner and such, and people, they're like, "Oh, okay," and they kind of like chuckle, and then, well, it's probably going to take a little longer. And we had to transition the building from a dental clinic to a medical clinic.
Yeah.
And so I like construction, and like I remember taking courses and such, and I was like, I can knock this out in like a week. I don't know if it'd be up to code, but I could do it in a week, right? But as we went through it, we found out, there are multiple steps that you have to go through. There's permitting. You have to make sure you're talking to the right people. You have to find teams, put them in place, and it kind of reminded me of what I do myself. I'm a primary care physician. And so when a patient comes, if they have a complex condition, I'm kind of like the quarterback. I look at all that's going on. I've treated patients before, so I understand where things are starting, where things will end up. I know how to navigate the system. And so after we struggled on our own for a while and made a few mistakes along the way, we decided that we should get a project manager. So someone who kind of oversees the whole project. And Yi actually was our project manager. And so he guided us and gave us the ins and out, and then provided gentle criticism when we made mistakes along the way.
That's
But it was all just knowledge building and adaptability. We learn as we go, and she was right. And Dr. Shi was right in that we'd have to look up all these terminology like RFPs. Like, what's an RFP, right?
good.
Like for people who are in real estate, it's really easy, right? Because you do it probably on a regular basis. But for someone who's never been, uh, then you have to look it up and then remind yourself several times again. But one additional thing that I thought was really helpful was that when we didn't know of who could do a specific job, we had to ask around. We had to ask for help because it was outside of our scope of practice. It was outside of our ability, And the more we asked, the more we understood that our Hmong community, there's so many young professionals out there already who do quality work. We don't know where to look, but we probably know somebody who knows somebody and has those resources on hand. And so we wanted to support small businesses and those who are local. And so we looked at, of course, got multiple bids from both large groups as well as medium and smaller groups. And then weighing the pros and the cons of each group and then making a decision from there. But it's quite a journey. And it's a lot of hands-on learning and a lot of mistakes being made along the way.
Yeah. Well, yeah, definitely. There's in construction, there's always mistakes. For me, the reason I do construction instead of what you guys do is we can make mistakes and we don't kill anybody. If we could have to correct that. Uh, um, and so you guys are probably a lot more cautious. Yeah. um, yeah, but for our team, we're pretty happy that we're able to kind of contribute in a minor way to help you guys with the construction side. I'm very glad that um, and there were a few things like on the our team handled the plumbing side. So like there were like if we added a few extra more fixture, then we had to get the state approval, and so we were glad that we didn't have to add a few more things on there. You know, they might have to. There were some other things with installations and stuff like that in terms of making sure our water lines are not messed up. But if we add a few more little fixture in there, then they were gonna ask us to redo the full permit through the state. So we're glad that we didn't have to do that. So now you two could like coach everybody to build a urgent care center now, right?
We are in the infancy of creating this, clinic, and you know, we know a little bit, but we're still in the early stages. And just going back a little bit to the construction, one of the greatest lessons that I learned from our wonderful project manager Yi was to understand the process may take longer than you think. We thought it was going to be done so quickly, and he kept gently telling me it's not going to happen because you don't know what's behind that wall, and when you find out what's behind that wall, it may change everything. And I'm like, oh man, I did not realize how important that is. And
Yeah,
and that's very similar to medicine. You're like, hey, you find this one problem, but you discover, oh my goodness, there's so much more problems behind it we didn't even realize. And so that was like a great lesson to us to like say, hey, make sure that you understand, be flexible, learn to be to pivot, learn to trust the people that help you. I want to give a shout out really quickly to the Minnesota Hmong Chamber of Commerce,
Yeah.
who helped us find really, really good
Mhm.
people in things that we needed, like especially IT and things like that. And the reason why I want to do that is because, as Dr. Charles Vang has said, there are so many wonderful Hmong organizations and people that have skill sets that you never knew that they had, and then or you weren't aware of. And now that we've been in the country for 51 years, it's quite exciting. You never knew that you needed these things, and now that they're here, you can really, reinvest in the community and ask them to help you.
yeah. Yeah, so Mike Hang is over there at Mocha, but I'm also the vice chair over there. But Mike kind of handle all of that. There's a lot of resources out there, right? And then in terms of construction, like Yi was a very. You want to find someone like Yi that tells you the truth, right? Because you don't want to like find someone that they're just meant to you, and you're like get this done in 2 weeks, and they know that's not done in 2 weeks. It won't be done. To for them to be able to like tell you the truth and make sure that like nudge you or let you know the truth that hey it's not gonna be completed and make sure we find the right people to get things done correctly. Um, I think he did it because he said you guys healed his tennis elbow, so I think he's ready to play pickleball now, right?
We can neither confirm nor deny. So
Okay. uh, yeah, so that's great. How about like all the staff and stuff like that? How does that work in terms of you guys finding the support staff and or is it just your family and spouse at this point? Yeah, how did that go about? Because now you guys are like really in charge of someone's, instead of having a nurse that the these large organizations are paying for. Like now you're in charge of their livelihood now, because they're there to really support you guys. And so how has that been going, or anything you guys could share with that?
Yeah, so we have two staff in addition to us both as providers. So one staff is primarily the front desk person, so does all the registration and insurance, all that is actually like a really large task for any one person to do, just because of how complex the healthcare system is. And then we have someone who is the MA phlebotomist. So this person does both. She's had training in both of those, and then we have Chi and I, who we do everything from being the doctor to rooming patients, being the MA. We will do phlebotomy. We'll be the janitors. We'll be the ones picking up all the equipment that's needed, or if we're out of toilet paper, one of us will do the runs. And so,
Yeah,
so we're doing everything with two staff that we've hired
yeah,
on.
yeah, yeah. Welcome to entrepreneurship. You start as a janitor. So I was the trash guy, like all this time until, even now we have a bunch of trash that it's not enough at one of my projects. It's not enough for me to get a dumpster there, and so that I'm like, oh, okay, now the project's completed. Probably tomorrow I gotta go, take a load of trash to throw away. Yeah, so that's just how it is. You guys, we're almost at the hour here, and so we're gonna open up for some questions. If you guys have questions for Dr. Chi and Dr. Charles, you guys can ask that on the chat here, and then I'll open up for questions in a little bit here. Um, we kind of touch a little bit about it, but what are all the services that you guys provide? Like, who should come see you guys? If you guys can talk about your services.
Yeah, so we see kids, adults, and the elderly. So we do a pretty broad spectrum. We do chronic disease management like asthma, COPD, diabetes, cholesterol, high blood pressure, gout. Those are things that we can manage. We do blood work. We can do urine and stool in the clinic, and then in addition to that, we also take care of our urgent care things, like if you're coming in because like you hurt your elbow, or sprain ankle, or hurt your back, or you got a cut that needs to be taken care of. Those are definitely things we can take care of. Just to be clear, we're not an ER, so if someone's having a heart attack or stroke, we'll direct you to the right place where you'll get the best care.
And what's the difference between what you guys are doing, having it being an urgent care and just being a primary practice, or something like that? Like, what's the difference here?
Yeah, and so for us, it actually doesn't feel very different. As primary care physicians, we're ready to take anything that walks through the door. So we're trained to make initial assessments, develop a plan, and then find a good treatment plan for the patient so that they will have the best outcome. So we're a jack of all trades is the way I think about it, and that adaptability has actually been real helpful for Dr. Chi and I. I know there's some physicians who specialize in pediatrics, for example, or some who are just adults. And so it's when it's the opposite, then it's harder for them to they can't actually see those patients. But Dr. Chi and I can see anybody along that spectrum.
Okay, cool. And then you guys have your soft opening, but can you talk? I mean, can we come to your grand opening? When are you guys gonna have it? Or can you talk a little bit about when you guys gonna like do your grand opening?
Absolutely. Our grand opening will be this coming Saturday on the 13th from 1 to 4 p.m. It is open to the public. We'd love for families to come, anyone who's available. If you really want to know who helped us with the construction, we have invited all of them to come, and we have a board that shows that to thank all the people that were part of the team that helped us to get to where we are. So that's something that you can find there as well. In addition to that, we just wanted to spend time interacting with the community who don't know us yet. Dr.
Mhm.
Charles and I, we did practice in Maplewood for about 5 to 7 years, and when we did that, we had left for a while, and then we're coming back now. So it's kind of like coming back home. And in addition to Maplewood, just has a large and very diverse population, and
Mhm.
we were able to reconnect with that community.
Yeah, and for those of you, if you can't join us this Saturday, that's okay. But if you can share the news with others, that'd be greatly appreciated. We know word of mouth is really important, especially within our Hmong community, especially for our elders in particular. And Dr. Chee and I, we've actually a good chunk of our patient base is actually the elder population, just because we both speak Hmong fluently, and we tend to speak softly and kindly as well, and so they tend to like us. But reaching out back to them again, it's been kind of difficult just because their accessibility to the internet, social media, and such is limited compared to the younger generation. So, if you can share with the elders in your family or on social media as well, that'd be greatly appreciated.
So I think right here, right, grand opening
Mhm.
uh, on the 13th. So I think that's a Saturday. Is
Mhm.
it Friday? It's Friday.
Saturday.
Saturday.
Saturday. Yeah, then that's the address there on Maplewood. Yeah, I'll drop by for a bit. I know that some of our buddies are coming from out of town. That will also be there. So good to kind of go and meet the future doctors that will be helping you guys out. Yeah, so be there, guys. I will be there. If you guys can, please make it. If you guys cannot, please share with everybody else that you guys know. Okay. Um, let's jump all the way to the future now, right? And then I think they have some questions. If you guys have questions, write it in the chat. I'll answer. I'll ask them the questions here. So what's the plan? We're going to have a Dr. Chee, Dr. Charles Vang hospital the next 10 years or so, or like have you guys, what's the plan for the future? You guys thought about it through?
Yeah. As with business, you should think about scaling. I
Yeah.
think that's a very important thing to do. Uh, we would love for this clinic to succeed, and if we can make it succeed here, we can build the other clinics elsewhere. And if they're, and for us, our goal is to create this accessibility for all communities and even in different areas. It's
Yeah.
great that we, live near Maplewood. I'm a original East Sider, St. Paul myself, and but it'd be great to have this in like Brooklyn Center or even Duluth or wherever we could go. It would be great. We've been so thankful to be part of the Maplewood neighborhood because I want to tell you the besides construction, you also have to deal with inspections and things like that, and the communication has been very efficient and professional, and we want to just give a shout out to the Maplewood city of Maplewood.
Yeah. Not to throw shades, but St. Paul, pay attention. I do a lot of construction in multiple places, so St. Paul needs some new new system in place. But yeah, so I hope you guys are able to in the future open, or all of us, right, with you guys leading, we are able to open larger facility. Hopefully, we could have our own hospital. Not that the current hospitals aren't helping, but I think there's a special place where if you go and the physicians, they do speak Hmong. I think that that especially helped our elders, right? And so, not that we're gonna not help other people, but there's just a place for that. You guys don't know, I grew up in San Diego and and so when this is a thing that we always try from a small towns like San Diego. Twin City here, you have such a large Hmong population that I feel like sometimes we do take things for granted as a community that there's all these little monk support and stuff like that. Even down to like when I was in San Diego, we would kill chicken and the neighbors would call the humane animal control on us, right? Versus here, like my mom, I'm like, Mom, like there's so many chicken, like you go get as many chicken as you want, right? And so like those little things that from a small town. Well,
Mhm.
San Diego's not a small town, but a small Hmong community like San Diego. Um, to me, this is a big accomplishment. I wish you guys the best of luck, and I hope that we could build a few hospitals in the future here. Um, yeah. Anything else you guys want to share? Then I'm gonna start asking questions from the community here. So we'll just go down here. Well, earlier Chai says hi, so that's that. He's here to learn. Um, he said you guys are secret millionaires. Uh, so now the secret's out. Sai, you guys know this guy, Sai. He's gonna be up here. Oh, I hope he's here before your thing, but maybe he might not be. Um, he said, I recommend they own the building and operate separately so that they can profit as rentals to the company holding the building and to do taxes, capital gains at 20% instead of 50. So the building is owned by a Hmong individual side already, but I hope that you guys could expand in the future. And that might be that's on this on the entrepreneur side, right?
Mhm.
That you guys can learn from someone that has done it like side to help you guys with the tax obligations. And
Yeah,
so
yeah, we appreciate the advice from Sai very much so. We also appreciate our current landlord as well. He has provided some mentorship as well to us. So we want to
yeah,
just say that as well.
yeah. And so you just doubled down on that recommendation. Do you guys take health partners? So I think you guys kind of talked a little bit about that. So health partners, that's a medical insurance, right?
Correct. And we do take health partners as well as most of the major insurance providers around the area. Within each insurance company, though, you have your own plans, and so we always recommend check within your own plan, make sure that we're within network. And if we're not in network, but if you need something that can be addressed by us, we also have the self pay option as well. Something to keep in mind: there's some plans where there's really high deductibles, meaning that you end up paying for the whole cost of your visit anyways when you see the doctor. And so the charge to the insurance companies tend to be much higher compared to the self-pay charges. So things to keep in mind as you're seeing your doctors and choosing them.
Yeah. Yeah. So Josh, there you look at the self-paid as well too, right? Sometimes even the
Mhm.
self-pay might be cheaper, so
Mhm.
might be better to just do that.
Mhm.
This is my Vang. She just want to say congratulations to you guys, and I'm proud of your accomplishment. So, 那个 you guys are so much. You guys did so much. So all your Vang family. Let's see. Mike Hang here as so he's the current chair of Mo Chamber of Commerce. If you guys don't know, but any tips or suggestions to upcoming doctors or current practitioners who are looking to make the jump? So we talked a little bit about this, but anything else you guys want to add to anyone that would want to go into this industry?
Sure. First, hi, Mike. Wanted to just circle back to some of the things we mentioned. So when you're making the transition from like an employee to a small business owner, especially as a physician, it's a big gap to cross. And finding a mentor is really important. Understanding that this is going to take some funding, so make sure you look into that and look to see what insurances are being taken in the area you're looking to work in, and what services are needed, and
Mhm.
where, and make sure, is this somewhere it's viable for what I can provide? Is there an audience that I can provide a service to? And in addition to that, you know, just starting out with small things like, how do you figure out how to do projections? How do you do like a business plan?
Mhm.
Those are like really important skills that we had to learn right away. And thankfully, there are a lot of people that can provide that service for you. And the state of Minnesota also, has services that are available on their website too, like the, Small Business Development Center. Those are
Mhm.
as well. So,
Yeah, a
Yeah,
couple things I would recommend for sure. So first is you got to have the right mindset. If you're used to getting things done exactly the way you want it, then that might be really difficult for you to start a business. So you got to be flexible, you got to be adaptive, you got to have the motivation to really overcome all the obstacles that come along the way. So that way you can get through and get your business open. Second is that you have to get started. A lot of people talk about it, but no one really plans or really prepares. And so there's just a few that does that. And the question is not really if you're ready; it's really if you're ready enough. You'll never be ready to the point where like it's easy. And you will continue to meet those challenges. And so if you're ready enough, you have that skill set, then go for it.
Yeah. Yeah, so they're talking a little bit about making the jump from making work maybe working for a corporate company versus now you starting your own facility, your own care, right? Yeah, and like I said earlier too, like I used to say everybody needs to be an entrepreneur, but I'm actually on the opposite side of that now, where it's like you really should think through to see if you really want it. But I think it will be very rewarding, because now you're building for yourself, you're building,
Mhm.
and you're able to make the decision and provide the care that you really want to, versus you working for someone else, and then I think now you're building legacy as well for yourself and your family, right? So I think it'll be worth it. I know you guys are still newer on here, but I'm very excited. I'm very happy you guys are doing this. And like I said earlier, not to push you guys, but you're used to pressure anyway. So like I really hope that we can open larger facilities in the future. Our us from the real estate side, we really haven't have anyone that really is able has build a medical facility that it's our niche yet, and I hope that in the future with you guys being in the industry, our development or our real estate group could really niche down to also building like medical facilities,
Mhm.
um, and I'm excited to see that in the future as we all collaborate and work with each other and grow. So
Yeah.
let's see. Bao, I think Bao yeah, Van says, what services do you guys? What services do you have to work with occupational care, assisting employers with care or injury employees? Uh, so I don't fully understand that question because it's not it's your guys' terminology. So I guess there's occupational cares. Like, do you guys do services for that? Do you understand that question?
Yeah, I'll take a shot at it. So we do not provide occupational therapy. And some places do that, but it's a specific type of medicine or healthcare. But we do assist if employees are injured. And so if people are injured at the workplace, if they need to be seen, they can always come here. There's a process that they will have to go through with their HR department and their work comp insurance plan. But once they do that, they can come here and we can see them. We treat them just like we treat any other patient. We provide the best care that we can with what we have on hand. And of course, we make an assessment and we practice within our scope of practice.
Yeah. Okay, so Bob, I hope that answers your question. Yi good, said you traded your 9 to 5 to 24/7. Yep, that's very true. That's why, or I should say, like for me at least, it's your 9 to 5 to your 5 to 9. So, well, I said welcome to the dark side. I think it will be. You made this trade already, but I think it will be very rewarding as you continue through this route. So, along with Yi, welcome both of you guys to the dark side. Um, let's see. From chat, just want to say fantastic to you guys. Chris Lee, just want to say hi, and then he says, what are services? What other services you guys offer? Chris, we talk about the different services, but you could go to their website. What is it? FocusPoint. What's the? I was
Focus
trying to.
Point, FocusPointurgentcare.com.
Yeah, FocusPointUrgentCare.com.
Yeah.
Okay, so you guys should go to their website there, and it has a list of all the services that they provide, and also like the prices, which I thought was really good. Let's see, OCC meds, DOTS, fit test, GLP. I have no idea what these mean, so maybe
Um,
you could kind of explain that and answer that question.
sure. First off, we want to say thank you very much to Dr. Chris Lee, who owns two urgent cares in North Carolina.
Oh
We
yes, it's that Chris. I didn't realize it. You're right.
So we appreciate him, and we've actually visited him, and he was gracious enough to show us around. He is an amazing physician and entrepreneur, and yes, we are looking forward to adding more services as we work on our workflow and get our business model going. Keep an eye out. We will have some surprises coming up. So
Yeah. Hey Chris, you and Steven, you guys down there need to have like a seminar conference down there for the rest of us to come visit you guys, and maybe we should do more medical niche down there. So just for you guys. Let's see here. Zhang Tao says, congratulations to both Dr. Vangs, and he was glad to be able to meet you guys. You guys know this guy, Mr. Chomberry Lee. He's running for mayor at Maplewood, so you're in his area. And so, yeah, you just want to say thank you for choosing Maplewood. Uh, yeah, so he's a great guy over there. I think he will get the mayor. Will be our next mayor at Maplewood. We're still doing some other things to try to support him at his run there. But really great guy, and he will be very supportive of our community once he become the mayor over there. Josh asked, "Do you guys provide unison recovery program?" Actually, yeah. Do you guys? Don't you guys have those things that you like put on you after you're hungover,
So
right?
I
Just
would
like
recommend.
I saw some nurses that do that, right? You know what I'm talking about?
So as a doctor, I would recommend limiting your intake of alcohol. And moderation is always recommended. But yes, there are medications that can be potentially helpful to reduce the withdrawal symptoms or the hangover symptoms.
They still want their license. If you want to know, Josh, if you really want to know, go talk to them at their facility or outside of the facility, maybe I should say. No, I did saw like I thought I saw some advertisement with some nurses that do like the IV bags or something like that. That's supposed to help. Um, and Yiku said Tufeng has a unison recovery program. Yes, I do. So if you guys go to Dr. Chi and Dr. Charles and they cannot provide you that recovery program, yeah, contact me.
Does it involve a bowl of pho?
You got to contact me to find out. Golden Flower. This is one of my sister-in-law. She said one of our lawyer. That's his sister-in-law. Which is that hi. Do you guys have internships opportunity for college students interested in medicine? Yes, her kids are ready. So do you guys have internship opportunities?
So we are currently in the early stages of the clinic, and when we get a better workflow set up, we will be offering definitely opportunities to learn, to shadow. And one of the reasons why Dr. Charles Vang and I kind of decided to also open this clinic just is to create an opportunity for those of us, who are interested in medicine, who didn't get a chance to connect with other people, and so that we can finally give back in that way as well. We like teaching like resident doctors. We like teaching pre-med students, and we just like teaching the general public as to what we're doing. So yeah, that's definitely something that's coming up. Keep an eye out. We will keep that inform the public when we're ready for that.
Yeah, yeah, and yeah. Once you guys have it, let us know too. We'll definitely help promote that. But yeah, no, yeah, definitely. I mean, these two guys, so reach out to them. I'm sure the kids will love to meet with them. I know that I'm bringing my daughter to the grand opening because she wanted to be a doctor, so I wanted her to meet you guys. How did you guys negotiate your contract with the insurance? Saying,
Yeah, that's a good question. So, it's important for you to find a skilled negotiator, whether that be a lawyer or a company who understands that process. And so, I would recommend getting bids or doing that initial consultation with at least 3 different groups, so that you can talk and get a good understanding of their experiences. So that way, that you can make an informed decision of who to choose from.
yeah. So, I mean, going back to sort of the theme we talked about earlier, or that we've been talking, finding the right people to help you out, right?
Mhm.
So, let's see here. Ye asks, I think it's this one. How soon should you hire a project manager for a project like this?
Okay, this is a great question. We did it the wrong way. So hire a project manager when you're ready and serious about moving forward. Okay, so I would say that you are already looking for a place. You've got your business plan, and you are thinking about doing projections. Okay, don't do what we did. Do it way later, where you're freaking out because the ship is sinking and you need someone to help you out. But
Yeah,
our project manager was amazing and helped us kind of figure things out.
yeah,
And so I would say get a project manager soon, but also make sure your project manager sort of has a foot in understanding like construction, real estate, and just kind of understanding like a lot of different things that you would never think about doing yourself. And we were lucky and blessed to have someone like that in our team.
yeah,
Yeah, and you also want to find someone who is invested in you and believes in your vision, your mission, and values as well. You can always pay somebody to be your project manager, right? But then you want to make sure that that person is really on your side. And we felt that Yi was one of those people who really truly believed in us, and he went the extra mile. And we found a lot of people who, uh, in the contractors, subcontractors that we utilize, that they're people like us, and they want to support each other, so that our community will grow and will be stronger. And because just of those mindsets, then people will go the extra mile, give the extra information, or give you advice that they typically wouldn't give to others. And so we really appreciate that. And just because Dr. Chee and I, that's how we like to do things too. We treat everyone as family. So people who walk through the door, I'm going to tell you what's going on, good or bad, but I'm going to help you through the situation, regardless of what it is.
yeah. So as soon as you guys can, and find the people that cares about you guys, that's invested in your project. I know that when I knew that you was managing your guys' project, I told my team like, okay, we can't mess up either. Like we gotta be on point as well, because these are friends of us, and we want this facility to be done on time, and don't shortcut anything.
Mhm.
And to if there are issues, then we just need to take a look at those issues right out there. So find someone that's reputable too. That
Mhm.
because I have done projects where the project manager or the developer was weird, and so it was kind of hard to work with that. Okay. I think that's it. Chris says for sure. I think Chris and Steven down there, down at North Carolina, they're gonna do some conferences for us to come down. So when you guys have it, let me know. I'll book my flight. I'll come down there to visit you guys. I've been meaning to come down there anyways. Congrats, Ali Nav. Says congrats to both of you guys. So I think that's it. Those are all the questions that were on here. We already over the hours, but first of all, just thank you to both of you guys. I'm very excited for this venture that you guys are, going through this together. I'm glad both of you guys are doing it together too, because it's in for me in terms of entrepreneurship, it's like very lonely. you know. And a few of you guys are on here. If you guys ever started your own business, it does become lonely, and it's good to have a partner. I do have my partner Yakututsilo. He does all the shit that, like, I don't want to do, and I'm glad that I could have him where, sometimes when we have our low days, we could kind of bounce ideas with
Mhm.
each other. I'm glad to be able to meet like a lot of, like-minded individuals like Yi and all these other guys that we are able to kind of share. Even like Chai Seong, I'm so glad to be able to meet him. And so that we could share. So I'm glad you guys are doing this together, so you guys could help support each other. Um, and then I'm glad that you guys are doing this in like the heart of it, the Hmong community, where you could provide those services to us. Um,
Mhm.
yeah, anything you want to share, with our community. Again, they're doing the grand opening this coming Saturday, from let me see, June 13th, from 1 to 4. So you guys could come out there. But anything you both want to share with our audience, with our community, and then I think we could leave it at that.
I just want to thank Tu Feng and the Hmong Wealth Builders for having us on today. This is a wonderful platform. We are beginning entrepreneurs and we are in the infancy. And so we may be coming to you guys to ask for more advice as well while we continue our journey. But in the same vein, we're here to provide a service to the community for everyone in the community. But if you happen to have like parents or someone who needs a Hmong speaking physician that's willing to lend a ear to them to help figure out what's going on, we're here. We're here for you guys and letting you know that we're here to be here long term.
Yeah, and thank you for having us here. I really believe in what you're trying to do. I think it's important that we continue to build each other so that we can all grow and we can all be better. So, former Senator Paul Wellstone says, and I like his phrase in that we all do better when we all do better. And I truly believe in that. And just because someone's light is shining doesn't mean that your light can't shine brightly as well. And so I think there's a lot of space and a lot of room. There's lots of seats at the table for us. If we support each other as a community, I think we'll be much better in the next 50 years. So I'm looking forward to it, to building it with two of you and all the current and future entrepreneurs on here.
Yeah. Yeah, for sure. And then thank you both for coming. Anything else you guys need in the future, from us, from any of our members or community members, feel free to reach out. I'm so glad again that you guys are doing this. I'm very happy for you guys. Wish you guys the best success. In the future, please come back, update us when you open up your next clinic or your hospital. But again, just remember, guys, this June 13th, Saturday, 1 to 4 p.m. Go to their grand opening. And even after the grand opening, right, please, everybody go support Dr. Chee and Dr. Charles at FocusPoint Urgent Care. All right? But that's it. See you guys. Thanks for tuning in.
Thank you, everyone, and have a good night.
Thank you.